And welcome to the media briefing with the Windsor-Essex County Health Unit on Wednesday, September the 28th. We are joined today by our manager of our epidemiology department, Ramsey D'Souza, our acting MOH, Dr. Shankar Nesathuri, as well as our interim CEO, Eleanor Groh. We are going to start our session with a presentation from Ramsey D'Souza, and then we'll move into our media questions. Thank you very much. Go ahead, Ramsey.
Members of the media, thank you for having me here today. I wanted to start off by talking about an initiative that the Health Unit has been working on during these past few months. We've realized that, with the pandemic, there's been a greater need for timely and up-to-date information to help our community and our partners make informed decisions, and the media as well. What the Health Unit has embarked on was using those principles that we applied during COVID with our COVID dashboards and our vaccination dashboards to other areas that are of great importance in public health. With that being said, I'm going to quickly share my screen to highlight what we're working on and where we see ourselves going in the foreseeable future. When you land onto our homepage, if you scroll to the bottom, there's a section that states data. That link is also quickly identified as, if you were to get to it by typing in weechi.org/data, it will take you to this landing page. We've called this landing page WESI, which is Windsor-Essex Health Status Indicator Dashboard, and it's grouped together in categories from chronic disease to substance use to mental health, infectious disease, and so on. The purpose of this is to have routine data that our community and partners can engage with, and will help inform what their next steps might be, and keep our community up to date with what is currently happening in terms of their health and the well-being of our residents, and also to develop evidence-informed programs and services as well. So a quick demo for what we have so far. This is a work in progress. We are populating this as time goes on. We're looking to some of our existing data sources that we have on hand to help provide some of that information to our community, and then we're also looking to make some attempts to do some primary data collection on areas where we do have data gaps as well. So here's an example of a dashboard that we put together recently around self-harm. This contains information related to, for example, in the top left, figures on rates in the province and in Windsor-Essex. However, if you want to look at a deeper dive, it also provides information on the gender breakdown as well for both Windsor-Essex and in Ontario. The figure next to it provides an overall breakdown in Windsor-Essex by age. The bottom left gives you an indication of what the top 5 reasons were for a self-harm visit in the emergency department. And looking at some of the age groups up above, if you wanted to identify which sex specifically is contributing to the increase, that can be broken down as well. So, for example, we see that the individuals 10 to 19 years of age have the highest rate across the board for the past 10 years. When we break that down by gender, we see that females have the highest rates, and they have for the foreseeable past. You can also look at, for those that do get admitted for more severe concerns as it relates to self-harm, that as well is highlighted here as well. We see some similar trends, but we also see a noticeable increase as well with certain age groups. Lastly, we do have information as well on self-harm mortality. Windsor-Essex, the rate has fluctuated as we compare to the province. Currently, the rate is lower than it was prior to the pandemic, but it's still a concern for us here in our community. As well, we see differences in gender, with males typically having higher rates, and certain age groups that have fluctuated over time. Typically, we see that within the 45 to 64 years of age. However, in 2021, we did see an increase among those that are 20 to 44 years of age. So this is just one area that the Health Unit has focused in on. When we move over to substance use as well, the media might be aware that we do have an opioid dashboard that we also co-host on our WeCost website as well. which we update on a weekly basis with information that we get from the ministry. But knowing that opioids is not just a substance of concern in our community, we have also looked into other substances such as alcohol, benzodiazepines, cannabis, cocaine, and methamphetamines. This as well looks at our ED visits as it relates to those substances. And you can tell by far and wide that alcohol has the highest rate, though opioids has been increasing as time has gone on. That same trend continues for alcohol over time, though we don't see that same level of hospitalizations with opioids and some of the other substances. Just as a final touch, we can also look to break this information down by age and gender. Across the province, Ontario has a higher rate as it relates to alcohol, for example. If we were to look at some other substances such as cannabis, you see that just as in previous slides, those rates are increasing over time. And with regards to specific ages that are contributing to this increase, it's those that are 15 to 24 years of age, and we do see an increase as well within those that are 25 to 44 years of age. So these are some of the areas that the health unit is looking to focus in on as we move forward into looking at areas outside of COVID-19. This, it ranges from everything that we're doing right now, and we are looking at areas as well to increase the availability of our current data. For example, a big project that we're also looking to undertake is how can we look to break down this data at a neighborhood level as well. So right now, what we've displayed so far gives a sense of what's happening overall in the community, but are there areas in the community that are disproportionately affected as well? So are we seeing something in South Windsor that we're not seeing in downtown Windsor? Or is there something happening in Tecumseh that we're not seeing in Windsor-Essex, in Windsor proper? So that's our next project. How can we look at these indicators, map them out in an area, at a smaller geographical area, which will then help us and our partners make targeted and better informed decisions. And that's from me so far. Thank you for giving me your time, and I'm happy to answer any questions.
Thank you very much, Ramsey. We will move into our first round of media questions with 2 questions per outlet. We will start with the Windsor Star.
Good morning. Ramsey, when do you expect the new dashboard to be completed and live for the public use?
The dashboard currently is available. In terms of its completeness, we don't foresee it ever being complete because we foresee adding to it as time goes on and having newer iterations of aspects that we want to add to it. So, for example, we may look at areas of mental health and identify that there are areas that we want to further explore, whether it's through primary data collection ourselves or collaborating with the partners to obtain some data that we can then look to highlight or showcase on our dashboard. So my approach is that it will never be complete because there's always something new and emerging that the health unit can report on, and will allow us to get a better sense of what the health needs are of our community.
How often will it be updated?
That's really dependent on the frequency of the information. So as I mentioned, for opioids, we get weekly data from the ministry that we can look to update. For information that relates to some of our hospitalization and hospital data, that's more on a yearly basis. Our infectious disease data is updated monthly. We have weekly updates for our influenza bulletin as well. So the frequency is different per topic area, but the goal is to have it be timely. So as soon as the information is available, we want to update our dashboard and move away from report writing as well, which will allow better engagement as well on our end with our partners and with the community.
Okay, thank you.
We'll move on to questions from AM 800.
Ramsey, were you and the team looking at doing something like this prior to the pandemic, or like you mentioned with the pandemic, the COVID dashboard, this kind of steered you and the team in this direction?
It's a bit of both. We when 2019 was coming to a close, we were looking to explore some of these ideas internally. We developed some examples of what we can look to present internally with some of the work that we're doing. But COVID-19 really ramped up the need to have timely information for planning and for decision making. So we wanted to continue that momentum going into other areas as well, and that's really been the key driver for us, was to see the success that we had with COVID-19 and the need for timely data and having that apply to other areas of public health and health outcomes in our community.
Thanks, Ramsey. Doctor, switching gears real quick, just wondering if you can provide a quick update on the student immunization. Last week it was at 223, still suspended. Do you have an update this morning?
Yeah, I think that number has decreased quite a bit. We'll send you the exact number if you send us an email on the number of people, but it has decreased from last week. Eleanor, do you know the number for today? I don't think I have it myself, but we can get it to you.
What I saw, I think we're under 100 now.
Yeah,
but we'll get the exact number to you.
Yeah, well, just from a reporting point of view, if you ask us, we'll give you the most up-to-date number of the people who are currently not up to date. I think the bigger message, though, is that we started with approximately 19,000 young people, and right now we're down to the hundreds who have not been up to date on their vaccine. So as a public health service and as a community, we have effectuated a plan. We have achieved the goal of vaccinating or bringing young people up to date. That's something that will help them when they start college, when they start university, or when they join the workforce, and will provide them some period of protection into their young adult lives.
Thank you.
We'll move on to questions from CTV.
Good morning. Yeah, actually, you know what? I'll send you an email too, or can I be looped into that email? I wouldn't mind having that number as well, if possible.
We'll get that to you for sure.
Okay, awesome. Great. Yeah, I guess switching gears as well, taking off of Rob. So I was told by a couple of pharmacists this week that there's been an influx in cases, COVID cases, in the last couple of weeks. So I guess the question here is, like, do you see the same trend? Are you aware of this? And if so, how should residents react to this recent development?
Well, Ramsey's here with us, and he leads the epidemiology service, but I'll start and perhaps he can supplement it. I think the indicators suggest that the burden of disease is greater now than it was 2 weeks ago. Secondly, I think that the number of cases is actually an underrepresentation of the true burden of COVID-19. I think as we move towards the fall, we have to consider COVID-19 as well as the burden of disease of other respiratory illnesses. We've had, and Ramsey can correct me, we've had approximately 650 deaths related to COVID since the beginning of the pandemic. I think that our advice still remains the same, and I think one of the key things that people can do is become up to date on their vaccines. If you're up to date on your vaccines, you're less likely to get seriously ill, you're less likely to be hospitalized, and you're less likely to die. And given that, I think that getting our vaccination rates to a better place would be something that we can all do to improve our health of ourselves, our families, and the population overall.
Ramsey, did you want to chime in on that one? Or,
yeah, just to add to,
yeah,
in terms of the data itself, we are seeing an increase. For those that are eligible for testing, our case counts have increased. Our wastewater, for the first time in a couple of weeks, or a few weeks actually, has shown an increase as well. And we will continue to monitor that trend to see if it's a blip, or if it's a trend that's going in the direction that we don't want it to go. But to that end as well, even prior to this time, there were other areas where we were seeing increases or high numbers when it comes to our hospitalizations or our outbreaks as well as it relates to COVID-19. This time in 2020, for the month of September, we only had about 4 to 6 outbreaks, but currently we're sitting well into our 20s. So times have changed, obviously, as it relates to our case of contact management, but the burden of illness in the past couple of weeks has increased.
Okay, great. Thanks for that, guys. And as well, you know, when I was talking to these pharmacists, they say that, you know, they worry about this year's flu season. So I asked them, like, you know, when would be a good time for us to start getting that out into the public? And they said, like, right now. Do you agree? Is this something we should be worried about?
Yeah, as soon as you're eligible for the flu vaccine and as soon as stocks are available, definitely get the flu shot. It's the flu also kills people, and I think one of the things to think about is that since the onset of the pandemic, we have less tolerance for respiratory disease overall. One core message is if you're sick, stay at home. Because we want to try to minimize the transmission of all respiratory illnesses from person to person.
Great advice. Thank you, Doctor. Thanks, Ramsey. Thanks, everybody.
Just to add a final point, typically with flu season in non-COVID years, we would see it start in late October, early November. But in this particular year, we were seeing cases well into our summer timeframe, and we actually had our cases had a case into this new season as well. So the flu season for us has already started. It's starting early. So the importance of immunization and being vaccinated against it is very important.
Okay, thank you.
Thank you. We'll move to questions from CBC.
Yeah, I mean, just quickly on the student suspensions thing, I think everyone would appreciate it if you could send us all an email with that, just because I'm sure everybody's going to be interested in this sort of thing, myself included. Just the first question I had, Ramsey, you mentioned earlier that the data site was a work in progress, and when I think it was Dawson who asked about when it's being completed, you said you don't foresee it ever being completed, but earlier you said it was a work in progress. I was just wondering when that sort of beta phase, if you will be completed. And I think that's what Dawson was meaning earlier. I'm not sure if you could answer that.
So the beta phase is complete, actually. I think if that's what you were referring to, the site is actually available for the public to access and view right now. I think what I meant in terms of completeness is we are looking to populate different sections of it. So if you go under a certain banner, for example, under chronic disease and risk factors, there's nothing there just yet because we're still working on developing those dashboards. When I said a work in progress was, we may look at in a year's time at a specific dashboard, whether it's opioids or infectious disease or any one of those, and look to add more content or look to refine the content there in terms of what's presented, so that it's more meaningful or it resonates with what is being discussed in the community. So we are looking to take an evaluative approach as well, knowing that having future iteration that in terms of improvements and quality improvement will always be at the forefront of what we do with our products.
If I could just supplement that, Ramsey, and just for me to understand it as well. Right now, the dashboard is alive. It has data elements that community members would find interesting and meaningful. We anticipate that as more data becomes available, we'll add new items to that data dashboard, as well as when data becomes updated, we'll also be updating the data on that dashboard. And to the extent that it's a living dashboard, it will continue to provide data elements that we think the community might find meaningful. Is that the correct way for us to understand it, Ramsey?
That's correct.
Okay, thanks for the clarification on that. And now with the bivalent vaccine being made available since the last meeting to all adults 18 years or older, and especially since now that we're seeing a rise in COVID cases compared to 2 weeks ago, and Dr. Nessethuri, I think you said the case count was underrepresented, and there have been an increase in testing cases and wastewater cases. What's the uptake like we're seeing with everyone who wants to get the bivalent shot?
Yeah, we can try to provide you the latest data elements if you send us an email, and we'll give you an estimate. Ramsey, do you have an estimate for us right now?
Not readily available.
So why don't we send you that estimate? I could say this though, overall, the overall number of people whose vaccinations are up to date is still not where we want it to be. And we can give you the most up-to-date number when you send us that email. But it's definitely an area of opportunity is to bring the population or the community up to date on its vaccination.
Okay, I'll send that email. Thanks very much.
We'll move into our round of follow-up questions with one question per media outlet, starting with the Windsor Star.
Just to follow up on that previous question, any advice for those seeking the bivalent vaccine? How can they go about obtaining it?
Well, the vaccine is available through multiple channels, including physicians' offices, at the public health service, through pharmacies, clinics. So I would recommend people who want to get vaccine to think of the channel that's most convenient for them to get the vaccine.
I see that the health unit has arranged for some pop-up clinics. Are those pop-up clinics all for the bivalent vaccine?
Yes, they are.
Well, the bivalent vaccine is available for people who are eligible for it, and those people can schedule an appointment at the or they can attend a pop-up clinic.
Okay, thank you.
And a follow-up question from AM 800.
Eleanor, this is for you. Obviously, first week as the interim CEO. I know you worked with Nicole last week, but just if you can, exciting opportunity for you. I know it's seen you around the board meetings and around the table there, but looking forward to this opportunity, even though it's an interim right now.
Yeah, you know what? It's really exciting. The team here has been amazing. Yeah, like you said, it's an interim. The board is in their recruitment process right now for the permanent CEO. But while I'm here to support that transition to the new CEO, and obviously to support Dr. Nethasari as well. But the team's amazing, and yeah, it's really exciting for me to be back working with everyone here at the health unit.
And sorry, one quick one here. Do you know how long usually a recruitment campaign like this could take to try to find, I guess, a permanent CEO?
You know, as I said, they're in the process right now. I can't really give you an exact date because it is a process. But I know the board is wishing to have this replacement as quickly as can be. So I'm thinking that they're moving quite quickly on that recruitment.
Thank you.
Yep.
And a follow-up question from CTV.
I'm good today, thanks.
Great. And a follow-up question from CBC.
Just in the data that we saw earlier, we saw that there was a rise in self-harm cases amongst women, especially before and during and after the pandemic. Compared to males, and we reported on this. We've been reporting on this for a little bit now. What are you doing to help not just women but men who are self-harming? Because, like I said, there has been a rise in incidents like this.
So first of all, 35 people died. Ramsey was just telling me today, 35 people died of suicide in Windsor-Essex last year. So it's a significant problem. Perhaps I can just start with some preliminary thoughts, and my colleagues will supplement this. At the Public Health Service, we want to try to prevent illness, and to that extent, we want the community overall and all people to have good mental health. And I think that's a societal goal. For people that have serious psychiatric illness, or people who engage in self-harm activities or contemplating self-harm activities, it's important for them to get access to mental health services. And that includes psychiatric care, which is provided by physicians, and also care provided by non-physician clinicians like psychologists and social workers. We have real gaps in this province on access to mental health services. And I think that's something that and I'm speaking in my capacity as a physician and not necessarily for the public health service, but I think that from my perspective, we have to improve access to mental health services. I think that's a key thing. I'm particularly concerned about access to mental health services for young people and children. I think that's a big gap. I think it's a well-recognized gap in services. And I think that's something that we have to address. Now, I believe my colleagues will supplement that. I think I've seen Eric on, and Eric maybe want to add some additional thoughts on that.
Yeah.
Yeah, thank you, Doctor. There are services available. Well, I'll acknowledge the potential bottleneck in services and the challenges with access. There are services available through our partners with Hotel du Grace Healthcare and their Regional Children's Center. And that's an organization which provides services to people of all ages. Our partners with CMHA Windsor-Essex and in partnership with Hotel du Grace Healthcare also operate the Transitional Stability Center, which is more for urgent care and crisis management. And that's services that's available for those 16 and older who are in crisis and in need of immediate help. So when we're speaking about self-harm and potential suicidal ideation, those are some of the services that we refer folks to. The health unit's efforts around mental health promotion are primarily focused upstream, and there are a number of different initiatives guided by our mental health promotion framework that we aim to set people on the proper course and provide them with the resources that they need to live a mentally live a positive lifestyle that supports positive mental health. But when we look at some of the downstream resources, just this past weekend, with our partners at CMHA Windsor-Essex, we hosted a suicide prevention awareness walk, and that's an important initiative that we are a part of every year that helps to shed light on the issue. It helps to take away some of the stigma associated with mental illness and some of the challenges that people face. So there's a number of things that we do as a health unit that are more upstream focused, but when we look downstream, there are resources available for people of all ages as well through some of our partners.
Okay, thanks.
All right. Thank you all very much for joining us today. Again, as mentioned, this is our last scheduled media briefing for this time frame. We will notify the media if any public health related topics come up and we wish to host another meeting. And as usual, we are always here for you to reach out to us with any of your questions. Thank you very much and have a wonderful day.
Thank you.
Thank you.
Thank you.
As well. Thank you.